The testing is indicating individuals and not tests themselves. So they are listing those per person. So if somebody tests multiple times, those are removed. We have recently had 2 deaths added to our county numbers, and we're always sad when we have a death. We had went through several days or a couple weeks without any deaths, and that was good news. But we have had a couple recently. All of our deaths have been in people 50 years or older, and most of them, the vast majority, have been over 70. That doesn't make that death any better, but that is just information. Most of the people do have some sort of underlying health condition. The majority of our tests being done are in people 20 to 39 years old. And the majority of positives are among 20 to 39-year-olds as well, with 36.1% being in the 20-year-olds. So those are interesting, good things to look at. It's what we watch and part of the information that we use to make decisions. The state health department has also added a dashboard with long-term care center information on it, and that's pretty preliminary right now. There's not a lot of information, but it is a good dashboard, and I think that that will continue to grow and expand as they have more details to put forth. I know that they are talking about how they will handle school data and if they'll have some specific dashboards for schools or universities, and I don't have any of those details. I believe that the state's still working through that. As far as exemptions, part of our regulations does have a process for exemptions as well as the state order. So we are processing those, but I do want to let people know that a request for an exemption doesn't mean it will automatically be given. We'll assess the event, the circumstances around the event, how people are taking precautions and how they can protect the individuals who are there. And we'll also look at the numbers and the current situations in the community at a time. So all of those things will go in and factor into whether or not an exemption is allowed. In terms of complaints, we are accepting complaints for businesses and agencies that may be violating the mask order, the regulations around masks or social distancing or the seating, those capacity limits. And we've taken those all along, but we are up and going with the new online system. We encourage people to use that system as opposed to emailing individual staff those things, because that will now slow down the process. So that is up. The staff that are going to be manning that call center, if you will, they are being trained this week, and they'll be up and started on Monday. So full-time staff that we have now have been handling those complaints so far, and Monday the new staff will be on board and handling those for us. So that will be a big help to us, as we'll be able to monitor their work and work with them, but that will free our full-time staff up to do the other things that they have to take care of. I wanted to also talk a little bit about contact tracing and to let people know that, you know, if you get a text or a call that says it's from the Indiana State Department of Health, or I have a number for you, and I want you to kind of pay attention to the number. It's 1-833-670-0067. And I know if people are like me, if I get a call from a number I don't recognize, I'm not answering my phone. You're going to have to leave me a message and I'll call you back. So there's lots of spam out there, and people often don't answer their phone if they don't recognize a number. But that 833-670-0067 is a number that would be from our contact tracers at the state. So if you see that number come through, please answer it or respond, or make sure that you check the voicemail and then call them back so that they can talk to you about whether or not you've been named as a contact, or whether or not it's in follow-up to your positive test results. Our nurses locally have been able to reach some people that didn't respond to those initial calls or texts from the state health department. And they've been able to do that because people recognized a local number. So I wanted to bring that to people's attention. That's very, very important that we get in contact with people right away so that we can intervene and stop the potential spread of infection. The other things about testing that I wanted to talk about, the State Department of Health has had several drive-throughs. They continue to do drive-through clinics. And in July, the drive-through clinics tested over 26,000 people. So that's a large number, and they're continuing to do those across the state. The Optum site here in Monroe County is scheduled now through September. And as you've heard me say before, that's a month-to-month kind of testing site. So right now that's on board through September. They are seeing 2 to 3 times the people that they are expected to see in a day. So they are doing well over 200 tests on most days, and some days it's well over 300. And they're expected, I think the cap that was initially expected was 132 tests a day. So they've been staying very, very busy. For the most part, test results are back within that 48 to 72 hours, but there certainly may be times when they are delayed, and we hear about that all the time across the country. That is not ideal, but sometimes that may happen. But in general, the turnaround time seems to be pretty good most of the time. I do also want to end with, if someone is tested, if you go in for testing due to symptoms or because you're a close contact, then you need to isolate or quarantine until those results are back. And then we determine whether or not you need to stay in isolation because your test was positive, or if you are, you're negative and you can go on. If you are a close contact, even if you are tested and you're negative, you need to stay in quarantine for the 14 days since your last exposure. So a negative test will not mean that you are released from quarantine for that 14 days. What it will tell us is if you're positive, then that process starts over and your isolation would be determined from that positive test. So that's what I have today. Just wanted to update you all on the data and the testing information. Thank you.
Okay, let's next go to Allison Moore.
Thank you, Chuck. I wanted to report that we still have a need for blood, and we have a blood drive scheduled 10 days away, August 24th. It is scheduled once again at the Monroe County Convention Center. We have information on our county website as to how you can go and select an appointment time. And by doing so, you go to the redcross.org website, put in the local zip code, and then select the Monroe County Convention Center spot and then a time that works for you. Right before this call, there were 18 spots still available, and we are only 10 days out. So I am excited that we have spots, because I know that we have had them fill up so quickly, but rightfully so, we want those spots to be filled. So if that's something that you can do, we would like to challenge you in the county to make that donation if possible. We also plan to have an additional blood drive once a month for the remainder of the calendar year. And I'd like to mention those dates. We now have those dates selected for the rest of the year. They are not currently on the Red Cross website as they were just secured, but they will be placing those on for you to make appointments for those selections very soon, hopefully by the beginning of next week. And they are scheduled for September the 29th, October the 14th, November the 9th, and December the 21st. So again, all of those additional beyond our August 24th blood drive will be for scheduled at the Monroe County Convention Center. They will all be by appointment only, and they are doing the antibodies testing of anyone that does in fact or can in fact donate blood. So thank you for that, and thank you for the Red Cross for working with us and the Monroe County Convention Center to make it an easy transition to get these up and running. We do, like Commissioner Thomas said, have face coverings still available for any Monroe County resident. We have them at almost every fire station and almost every trustee's office in the county. If it's the need that you have, you can go to our county website at co.monroe.in.us and find out what place might be closest to your resident or what place where you're conveniently at the time. We do ask that you call and make an appointment and let those individuals know that you're stopping by to get those face coverings between the hours of 9 to 3, unless you're stopping at the north door at the courthouse on Tuesday, Wednesday, or Thursday between 9 and 4. And then lastly, I just want to remind individuals, we have had a couple questions here and there from people about laundering their face coverings. And so the majority of the face coverings that we hand out, we do have disposable, but the majority of the face coverings that we have distributed to the public have been cloth masks. And so they can be laundered just as you would do your actual clothing. And you can do that by hand in a sink or, of course, through the washing machine. But we do have information, and our health department has information on both of our website and theirs about keeping those safe and keeping those materials clean. And so just wanted to reiterate that that needs to happen since we've had those few questions, and there is information out and available for anybody that may have questions about that as well. So Chuck, that's all I have today. Thank you so much.
Okay, let's go to Brian Shockney from IU Health.
Thank you. Sorry I was late for attending. I was on a meeting with IU Health, and I just want to say that we were held up, Monroe County was held up as a best practice county in the state of Indiana for all that we have done to make sure that we are caring for our residents with the additional restrictions on numbers of meetings, the county health department meetings, the Indiana University campus and their program. Lots of kudos to all of you on this call and those in our community regarding Monroe County and all the great things that are happening here and how we've been able to make sure that our residents are kept healthy. I want to begin reflecting on where we were 5 months ago. We've been practicing resiliency here, trying to, we're all kind of getting tired of living this life the way we are. And I just wanted to remind us of where we were 5 months ago. There were only 12 patients in Indiana that had been reported with COVID positive. And IU Health and all of its facilities only had 7 suspected patients. And if you'll recall and go back to the news, we had just released a press release on a patient who had come through our emergency department and had been reported over social media who tested positive, and we released to the community because their symptoms didn't require inpatient care. The CDC had just issued its COVID-19 emergency declaration for healthcare providers, and we were just discussing canceling elective procedures. And as you might recall, we were using the words flatten the curve quite a bit. As of midnight last night, Indiana has experienced over 77,600 cases, 878,000 tested, and we've sadly experienced over 2,900 deaths. Monroe County has had 777 positive cases with over 18,000 tested, and we have had about 32 lives lost in this pandemic. So IU Health, we're approaching over 2,000 admissions. We've resulted over 159,000 tests for Indiana residents, 690 of those being our IU Health employees here in the South Central region and across the state, and provided over 61,800 virtual visits for Indiana residents. So Chuck, if you're able to put up the chart, our South Central region continues to hover between that number of 11 to 15 patients every day. And recall that that's every day we're turning patients over, discharging and new ones coming in. And this is what we call flattening of the curve, just as we said. And so after that initial surge, we've learned a lot over these past 5 months, and we've been able to do things here in our community that's, as we see this uptick that started in the 28th of June, we've been able to flatten the curve. And so I just want to say thank you to everyone for their work and not stressing the resources of our community and of our hospital. Second thing I want to talk about is visitors, and they are important to the healing process. they require, the patients require support from their loved ones to be sure that they know about their medicines, about their discharge instructions, and all the things that are important to their care. And so I just want to say thank you to all the visitors, patient family members who have been patient with us as we start to look at new guidelines for visitors, and we've been allowing additional visitors in our facilities. But thank you for your patience over the past 5 months as we have been trying to protect our patients, protect our team members, and protect you as well. It's not easy to have a loved one in the hospital and not be able to visit them, or when a loved one has surgery, to only have one person in attendance and not multiple people. So we just want to thank you for that. The third thing I want to say is I want to talk about the Learn Fund. Taking care of our community is really important to IU Health. And that's why we're excited about the Learn Fund that we are partnering on with the Community Foundation of Bloomington and Monroe County. We're happy that the IU Health Foundation and the IU Health South Central Region were able to contribute to this important project through the Community Investment Fund. Together with United Way of Monroe County and the Community Foundation, the Learn Fund was able to launch last week with $150,000. This new initiative is focused on helping children in Monroe County get the virtual learning resources that they need and help their families get the childcare that they need. By helping low-income families and those going through extraordinary circumstances in these ways, we are ensuring these children have access to education during this next normal. Increased access to quality childcare also means that more parents and more guardians are able to get back into the workforce. So you too can donate to this great resource for our community by visiting cfbmc.org and selecting the Learn Fund, L-E-A-R-N Fund, and continue this path to helping families in Monroe County. And I want to close as I began with emphasizing the journey we all have endured and continue to endure in the national, state, and community. You know, some days it seems as though the initial weeks and months were long ago, and then we hear of a loved one that has tested positive, or we learn of another life that has been lost to this virus. And we realize that it has never been more important than to use our everyday tools in our toolbox to keep ourselves and others safe, washing our hands, wearing our masks, practicing physical distancing, doing all those things that protect our community and has kept us where we are today and flattening this curve. I'm also continually amazed at the strength, the cooperation, and the communication and willingness of the leaders that you see on this screen every Friday in our community to do what it takes to protect and provide for us all. The mayor, the county commissioners, the health commissioners, IU, they've had to make some tough decisions, not decisions that were popular by others, but it is making a difference. 5 incredible months that have demonstrated the strength and resiliency of our communities and what continues to give me hope and security that whether this pandemic is over in 1 month or 1 year, we will all be the better for having lived through it. Thank you.
Okay, and not least, Kirk White. It has been an eventful week at IU.
Yes, it has. Good afternoon. I think everybody knows we started at the Bloomington campus with our testing operation for students moving in. And that's really at that phase where we were having what we called a drop and go. So we were expanding the move-in period over 2 weeks so as not to have as many people together at our residence home move-ins in stairwells and elevators and things like that. So that started this past week. As I think most of you know, we've figured out that what we stood up at the stadium was the largest on-site testing facility in the state, and it'll continue to be that way on through August 23rd. And so then on Wednesday, we stood up an additional 2 testing facilities, one at the tennis pavilion and the other one at Garrett Fieldhouse on campus. So there's a drive-in facility there and another testing site there at Garrett for walk-in in the center part of campus. Those 2 are focused on our off-campus students. So we're utilizing a saliva test that is then sent off, and we get the results back in 3 days at the most, sometimes less. The other one that we started with the drive-in operation for the residence halls residents at the stadium is an instant test. And we get those results in 20 minutes because we wanted those before people actually moved in to the residence halls. So that started last week. And as I say, it will continue. Next week, we will see the usual move-in pattern on the Bloomington campus with much additional traffic as people are moving in our residence halls, as in addition to off-campus residences in the community as well. Classes will begin, just as a reminder, on the 24th of August, on that Monday, and we will have our usual IU guides out around the campus to help students who need to be reminded to have their masks on if they don't, or if they need one. We'll be distributing them at 13 different points around the campus on the 24th. We'll also say that our contact tracing staff at Indiana University is operating and has been now for a while, and will continue to increase in size. That team will continue to increase its size and their capability. There will be contact tracers based both in Bloomington and at Indianapolis to cover the requirements for the university throughout the state. And as I think I've mentioned before, we've hired additional staff to do just that. I really want to say thanks to our community partners at the Chamber and the city, the Downtown Merchants, the Apartment Owners Association, and others who have helped us with a community awareness campaign, really a communications campaign that we can coordinate both between the university and the community, the campus and the community. We're sharing the themes on this, and the goal is to normalize student behavior of wearing masks and practicing the other guidelines of distancing and hand washing and so on. And I think just for a moment, I think I'll share my screen and show you a few samples of this effort. We'll start with this one. You'll see these poster and digital signage. Showing love is a show of strength, empathy, always in style, kindness, keeping healthy, strength looks good on you. Courage is all about kindness. These are the kind of messages that we want our campus to see and to share among itself. Caring about others is a good look. Compassion looks good on you. So I think this, and as well as another, this is the one that we've designed that can be shared throughout the community. So kindness is always in style. And we've invited our community partners, the city, the chamber, others to use, Ivy Tech even, to use their logo here, to use this same messaging so that it looks consistent throughout the community. This is the way we want Bloomington and Monroe County to be. And these two taglines, masking for a friend, practicing safe 6. I like that. Good idea. So those are the messages that our communications team at the city, Mary Catherine Carmichael and others, and our folks in our communications and marketing at IU Studios have put together a great cooperative effort. And finally, also the city, and with Mayor Hamilton's leadership, has assembled a guide to off-campus living that will be distributed to off-campus residents. The mayor might talk some more about that, but great cooperative effort. We're sharing messages in that publication that the city is putting together as well. So I think we're in as good a place as we can be at this point. Our testing is going well. It's right along the lines that we expected. And I think as we've discussed earlier, once we get a full baseline and feel comfortable that it's representative, we'll certainly be sharing that publicly so that everybody can see the results of our on-site testing. And so with that, I'll conclude and wait for any questions.
Okay, we will go ahead and move to questions. This one coming from Binta Boutier from WTIU, WFIU for Julie or Penny. Do you know how many requests, it says for an expedition, I think that may be exemption to gathering size limits have been submitted so far. How many reports or complaints have there been?
I was going to see if, there she is, good. She'd be better at answering that than I would.
Sorry about that. I know that in the first week, we had at least 50 complaints that came in. As of today, that number I think is probably higher, but I know we've had over 50 complaints. We do have to process them and make sure some of them could be duplicates. Some, will not be things that are actual violations. So sometimes you get a complaint. We've seen this back when restaurants first started opening up, and people might complain about something that they thought was a violation, but it wasn't. So we're handling all of those regardless, but so far, at least 50 have come in. In terms of exemptions, that is still harder for me to give you a number because we are still getting a lot of those sent to us individually. And sometimes someone will send the same request to several of us. And that I understand that completely from before, because we can all be very difficult to catch. And so you send it to several people and then hope that you get a response from one of those people very, very quickly. So that is still kind of to be determined. I would say that we've had at least a dozen. And again, I took some time off last week, and so those exact numbers I don't have, but I know that we've had, I would say, at least a dozen at least calls and people asking for information on the exemption request. Sometimes it's a matter of, I think we're having this, do we need to file an exemption, or does this fall outside of that? So the exact number of exemptions, going forward, I'll have a better number for you because the system that we're using should be able to tell us that.
Okay, going back, speaking of numbers, Kirk, follow up on the IU testing. I know that some of this is still TBD, but the question from Binta Boutier, how will IU be reporting COVID test results stats? You mentioned after the arrival testing, we'll report what those are, but ongoing, we'll be doing something with those.
Yes, I think we'll be posting those on a weekly basis so that we can continue to keep the public informed as well. Of course, we'll continue our very regular coordination and communications with the county and state health officials.
Okay. Question from the B Square Beacon, Dave Askins for Mayor Hamilton regarding voting. There's one reason on the absentee ballot application form that says, quote, I will be confined to my residence, a healthcare facility, or a hospital due to illness or injury during the entire 12 hours that the polls are open, end quote. There's been a call from some for an interpretation that says, check that box if you're concerned about other people having an illness, that is COVID-19, and you aren't leaving your house, so you're confined due to illness. Would you, as mayor, say to the voting public, sure, go ahead and check that box. It's up to you if you want to interpret the form that way.
Well, thanks for the question. Again, I am really disappointed and hope people will reach out to the state government to indicate how important it is to clearly allow mail-in voting for all of us. Many states are doing it. We're not. I think that's a big mistake. It is important to note that one of the 11 reasons you may give to ask for an absentee ballot so that you may fill out that and mail in your vote, among others, like you're going to be out of the county or you're working all 12 hours or a number of others. There is one that says you are confined due to illness or injury. And I will just say, I actually think each person may say, I am confined due to illness. I'm confined because of the COVID spread, and I need a mail-in ballot for that. I think that's a reasonable position. It's unfortunately not clarified by our election officials, which I wish we could. There may be litigation about this stuff, but each person can apply for a ballot and indicate their reason. And I actually do think, and I'm considering this myself, that you may say it is due to illness that I will be confined and not able to vote in person. So I think that's a good question. And again, this really should be clarified by the state election board and the governor. And I can share their numbers with, if you want, in the chat for that. Thanks.
Question from Emily Ernsberger from the HT for Penny. Do we know the symptoms of those younger people being tested and testing positive, or if they are asymptomatic?
Yeah, Emily, I don't have that with me readily. The nurses have not indicated any specific trends that they have seen regarding that. But again, the contact tracers at the state do those initial interviews, and some of that may be captured there. But I can check on that and see. The Optum site certainly tests people whether they're symptomatic or not. Some of the other sites, you still do need to have symptoms or be a close contact or something like that, which is extremely reasonable. And so I can check on that. We can see if we can dig around. We will have to sort of search for that information, but we'll see what we can find for you.
Question from the B Square Beacon for Penny again about the positivity rate. Could you go over the bit again about unique individuals? And he says, let's say John Doe got tested Monday, Tuesday, Wednesday, Thursday, and was positive on those days, and then on Friday tested negative. From what you said, it sounds like those 4 tests will count towards the basic tally, but for positive rate calculations, that one person is going to count just once. Is that correct?
I believe you are correct, Dave. And so I'm just going to, I opened this up from the state's dashboard, and I'm going to read it to you so that we're all on the same page. The number of individuals tested refers to the distinct number of individuals who have a PCR test for COVID-19. The total number of tests administered refers to the total number of PCR tests that have been conducted and counts all PCR tests for single individual who was tested multiple times. Tests are assigned to the date for which the test was performed. These tests are provisional and reflects only those reported to ISDH. Numbers should not be characterized as a comprehensive total. So I believe that we are on the same page. If I test multiple times, that's going to count as one test. And that positive in the positivity rate is just going to be counted once as well.
A question directed at Kirk, but probably Penny as well, and asking, will positive tests for IU count towards the Monroe County data?
Do it. I'll jump in from the state's perspective. Yes, I think we've talked about this a little bit in the past, and my understanding, the changes typically with communicable diseases, it is where you live. And so that's kind of your permanent address. But because of COVID-19 and the changes and the need for us to know where students are and where any individual is, and have those direct counts to tell where we are in this outbreak for our community, they are going to give us that information by where someone is living. And I'll let Kirk talk about this, but I know that IU is also putting systems in place that will make sure that we capture local addresses.
Yes, that's right. That's important. And our statewide team is working closely with the Indiana Department of Health to discuss how, when we send those numbers forward, that we're not, as we do that, it's not skewing things for a particular community. That's an important point. So our doctors are aware of how this could affect the numbers in a locality, and are working with Department of Health and with the local departments as well, so that they can interpret what's happening. Because obviously, as we we test tens of thousands over the next 2 weeks, that's going to make a big change for Monroe County.
And again, we will be, IU, the royal we here, we will be publishing those numbers coming up on that weekly dashboard. I'm not seeing any other media questions. We'll go ahead and wrap it up. I do want to acknowledge a nice compliment from our YouTube watchers. One of our YouTube watchers saying she appreciated us coming together to provide this information weekly. And so I'll pitch again for us being back next week. And let me put one other plug in for an IU product. We've been doing a bunch of webinars at IU that have to do with all of the things related to COVID, specifically for IU, but a lot of things related to COVID at large. Those are all available on archive at broadcast.iu.edu. Anybody can go watch those, and those are a good source of information as well. But we will be back to talk about more of the situation here in the city and the county with IU Health and IU next week at 1:15, and we will see you then. Thanks.
Thank you, Chuck.
Well,
Thanks, everybody.
Thanks,
Good weekend.